My name is Joe Aherne. I'm CEO of the Leading Edge Group of Companies, a lean educational and training organisation. Lean thinking has been instrumental in driving the Japanese motor giant Toyota to the top of the global automotive industry. Thanks to this pioneering success of Toyota, lean concepts have been implemented in many different organisations across the globe, from manufacturing to supply chain, to healthcare, to finance, and indeed to general services. However, there is still a lack of understanding on what you determine or what you define as lean thinking.
Lean thinking for me is about my patients and my staff and the value that is added to their experience in the workplace, in the hospital that I manage. So it's about removing waiting times, removing overworking, removing anything in the process that makes their working life and their patient experience worse.
Lean thinking for me in healthcare is looking at the resources we already have now and learning to do better with what we have. It's about getting value for money for our patients, for my staff, for processes to flow much better than they do now, and taking the waste out of all those processes that have us going round in circles and getting nowhere fast.
From my current experience, Lean has really made a big difference in the world of outpatients. Now you can, as a patient, know where your referral is in the whole process, because we track and we manage everything in a standard way. So it doesn't matter who you're referred to, you are in that process and you're going through the same pathways as every other patient who's also been referred. Not only that, your referral is tracked. So if you want to find out where you are in the process, we can tell you immediately.
My experience of Lean first came about when I worked for Columbia Healthcare in Florida. Lean would have been something that they did as a matter of everyday work. So, for example, a patient pathway, a patient with chest pain was treated the same way regardless of who was treating this patient. It was about getting value for money, it was about minimising risk, it was about quality of care. And it came about because everybody was on the same page working leanly. It was a private corporation, we had to be competitive.
From a healthcare perspective, we're the biggest spend this government has got, really, the public service. And when you look at a net saving next year required from the health service of between 400 and 800 million, we really are going to have to tighten our processes and put things in place, even down at the grassroots level, which is why Lean is so good, because it's about individuals understanding their role in the wider picture.
Having worked in the private healthcare sector, I think there are lessons that we could transfer over to the public healthcare sector. There was awareness, I suppose, in the private sector that a need to get value for money, to measure what it is that we do right and what we do wrong so that we can be accountable for what we do. And we are beginning to learn those lessons, and I think they absolutely could apply to public healthcare. We measure what we'll do, we'll get better value for money.
Well, in my organisation it would be about training from the grassroots level, starting with one-day courses to understand lean tools and how they fit into the healthcare environment, and building that up through the strata of management and so on and so forth, so that there is a lean culture developing. Organisational development through Lean is a real winner in the NHS Scotland, Bolton, improving care systems, using Lean tools, so that's something I'd be looking at for sustainability.
Lean is something that's very new to the healthcare sector. Through education we're beginning to learn what it is that we probably need to do. I would like to see it put in at management level, where it can come down through the strata of the organisation, but also from the grassroots up, to have a governance structure over it where we have sustainability through education, and hopefully get it through every employee in the organisation, so we're all on the same page.
I hope you found this video of interest. I hope you now have a much better understanding of what Lean is and why Lean is applicable across all business processes, functions and across different sectors. However, one important point is that in order for Lean to be sustainable, you must train and educate your staff in the principles and methodologies of Lean. Please contact the Leading Edge Group if you would like to embark on a lean healthcare education programme with full international accreditation. Thank you for listening.